Hi, my name is Banda. I work with NEST360 as the biomedical engineering manager, and I am also a technical advisor in the Ministry of Health of Malawi, Physical Asset Management Division. So today I just want to talk about the role of healthy technology in small and sick newborn care. So as you know, technology is very important in reducing preventable newborn death. Our babies, they are very vulnerable and they are very fragile, and they cannot describe their own symptoms. So that's why we need this technology for timely detection and intervention to prevent preventable newborn death. So I can speak of devices like a pulse oximeter, which is used to detect hypoxia. We have the glucometer, which is used to detect hypoglycemia, and we also have a thermometer, a simple thermometer to detect hypothermia in newborns. And from that, now we can provide interventions to prevent death of a newborn. So we have things like oxygen concentrator to treat hypoxia. So you see, some of these don't have any substitute. You have no substitute for oxygen. And then we have a CPAP to treat RDS, okay? And we also have a radiant warmer to manage hypothermia in newborns. We also have a conductive warmer for the same reasons. So what makes these technologies work in low resource settings? Yeah, so first of all, I think training is very key. Our biomedics need to have the right skills and knowledge in order to maintain and keep the devices functional, safe, and also for them to last a long time. So training, number one. And number two, availability of spare parts. Okay, for the biomedics work to really be effective, we need all the tools available. So we need the spare parts in order to do planned preventive maintenance and corrective maintenance. And thirdly, I think the tools themselves, repair tools and also testing tools are very key. Yeah, we cannot diagnose or we cannot pinpoint the fault of a device without these tools. So we need the tools available at all times. And secondly, we can also talk about the devices themselves. So the devices have to be rugged and robust enough. You know, the environment in low resource settings is unforgiving to equipment. We have power issues, power fluctuations, fragmented maintenance. Okay, so we need devices which are robust. I can cite maybe Pullman Bubble CPAP, which is very durable. We never face challenges with that type of device, and most of the devices in the NEST bundle. To add to that, I think training on its own is not enough. So the biomedics also, they need continuous support from anywhere else. So for things like mentorship, to build their skills, also to address some of the gaps that they might have in the course of maintaining the device. So things like supportive supervision and the mentorship, as I've already mentioned. And also another key element is collaboration with healthcare workers. This is very key because when biomedics and the healthcare workers are working together, they support each other in identifying issues with the equipment very early. Even the biomed will support the clinical team with user trainings to minimize user errors as well. So I think collaboration is very key. So what is the government role in all this? I think the government have a very big role to refine the procurement systems as well as work with developmental partners so that the equipment that is brought or donated is robust enough to reduce proliferation and make it more of a manageable brands of equipment in country. And I think secondly, the government also has a role to make sure that the biomeds have all the necessary tools, the spare parts, consistent availability, so that they are able to do their work properly. And then thirdly, I think the government is also responsible for providing the training, building the capacity of the biomeds, instituting mentorship system, working with local professional associations to provide continuous mentorship. And I think lastly, there's a very huge gap in funding when it comes to maintenance of medical equipment. So I think the government should consider increasing the funding to the maintenance of medical equipment, and if also they can make it ring-fenced so that it's only being used for maintenance of medical equipment. Thank you so much.